So today our group is going to present pernicious anemia, which is vitamin B12 deficiency.
So vitamin B12 is also known as cobalamin, and it's a water-soluble vitamin, meaning that you cannot overdose on B12. Any extra B12 consumed will be excreted in the urine. And in a deficiency of vitamin B12, which is also known as pernicious anemia, the body doesn't have sufficient red blood cells because B12 helps make the red blood cells, and consequence of not having enough red blood cells is that there's not enough oxygen in the blood. It is one of two megaloblastic or macrocytic anemias. The other one is folate, and they're characterized by large red blood cells, as you can see in the picture. Normal marrow, the blood cells are all the same size. Red blood cells, in the megaloblastic, they're larger. And B12 is required for enzymatic reactions, which we will get to later on in the presentation.
Under normal conditions, when vitamin B12 is consumed through the diet, the vitamin becomes disassociated from the food in the acidic environment in the stomach. There is intrinsic factors that is secreted by the parietal cells of the gastric glands in the stomach, and what this intrinsic factor does is it forms a complex with dietary B12, and then it gets transported to the ileum of the small intestines, where the vitamin can be absorbed and digested. When there is severe malabsorption of vitamin B12, and for those people who are suffering with pernicious anemia, there is an autoimmune destruction of the gastric parietal cells that are responsible for the synthesis of intrinsic factor. And so this lack of intrinsic factor prevents B12 transportation and absorption in the body by the intestines. Some of the signs and symptoms of someone who is suffering with pernicious anemia can be fatigue, paleness, shortness of breath, headaches, or dizziness. If someone is experiencing long-term low vitamin B12 levels that is left untreated, it can actually have an impact on your nervous system. And some of those long-term symptoms can be confusion, slower thinking, forgetfulness, or memory loss. People can experience trouble walking, uncontrollable muscle movements. They can experience those pins and needles in their extremities. And they can also actually experience some gastrointestinal manifestations like loss of appetite, weight loss, or diarrhea.
So in the part of nutrition, diagnosis, and screening, we are going to take a look at what are the necessary blood tests that are required to diagnose someone with pernicious anemia. And there are two main tests. First is a complete blood count that measures hemoglobin. And another blood test measures vitamin B12 levels in the blood. However, I believe it's important to note that you may still have the condition even if your vitamin B12 levels are normal. So as we can see at this table, healthy and abnormal blood levels in adults, hemoglobin should be 13 or higher, 13 grams or 12 grams or higher for men and 12 for women. The person is diagnosed with anemia if it's lower than 12 grams for men, or if it's lower than 11 for women. It is very important to measure vitamin B12 levels in the blood in order to diagnose someone with pernicious anemia. So a normal level would be 400 or higher picogram per milliliter. And it would be vitamin B12 deficiency if it's 200 or lower.
So most deficiency of B12 comes from inadequate absorption as opposed to inadequate intake. And the most At-risk groups are older adults because they have reduced gastric acid secretions, which in the gastric acid secretions are necessary to absorb B12. Vegetarians and vegans, because B12 is only found naturally in animal sources. Individuals with gastrointestinal disorders are those who have had a gastrectomy. So this again comes back to the gastric acid secretions and the intrinsic factor, which is necessary for absorption. Breastfed infants of vegan women, and as we know, vegans are more likely to be deficient. So if an infant is being exclusively breastfed by a vegan person, then the infant will more likely be deficient. And then those who use certain medications are also at risk, like metformin, proton pump inhibitors. Metformin reduces the absorption of B12, and proton pump inhibitors are used to inhibit gastric acid secretions in treatments like GERD. So if there's less gastric acid secretions, there's less absorption of the B12, and incidence is higher in those of Northern European descent and less common in those of African descent, other parts of Europe. Nutrition and dietary intervention. B12 is found naturally in the microorganisms in animals, so it's going to be most abundant in meat, fish, and eggs. Beef liver has about 70 micrograms of B12. It can also be supplemented in different forms. High-dose oral form is going to be in the form of cyanocobalamin. There's also a nasal spray, and you can also get an intramuscular injection, and that's in the form of cyanocobalamin or hydroxycobalamin. And it's also fortified in products like cereal and nutritional yeast. Nutritional yeast can have anywhere from 8.3 to 24 micrograms of B12. And on the right, there is a table of the recommended dietary allowances for B12. So for most adults, they'll need about 2.4 micrograms. That's really not that much at all. Cheddar cheese has about 0.5 micrograms of B12. And because it's a water-soluble vitamin, there's no upper limit. Any extra B12 is excreted in the urine.
If your doctor diagnoses you with vitamin B12 deficiency, anemia, your treatment will depend on the cause and seriousness of your condition, obviously. However, some people need lifelong treatments. Your doctor will likely also suggest some changes in your diet. Eating more foods that are high in vitamin B12 can be very helpful. The autoimmune diet protocol described in Dr. Sarah Ballantyne's book, Get Rid of Irritants and Major Offenders to Gut Health, is designed to suit your immune system, reduce inflammation, and help your body go on a path of healing. Gluten, for example, tends to pry open those tight junctions in the gut. This allows the passage of toxins and food particles into the blood flow, which sets off inflammatory and autoimmune feedbacks. It's no surprise that gluten-free diet seems to help against multiple different autoimmune diseases such as hepatitis or type 1 diabetes. All autoimmune diseases, just like PA is. So as we can see on this slide, there are foods that people with pernicious anemia should avoid, such as grains, eggs, dairy products, seeds, nuts, dry fruits, sweeteners. And there are also foods that are good for these people to eat, which are meat, or especially organ meats, fruits, vegetables, mushrooms, good fats, probiotic foods, herbs and spices, water, vinegar, honey. So in the last slide of nutrition monitoring and evaluation, I would like to take a chance and talk a little bit more about also the therapies and treatments for anemia. And there are two major ones. First is the vitamin B12 medicine that can be prescribed by your provider. This can come in 3 different forms, which can be taken by the mouth as in a form of a pill. It can come in a form of a nose spray or as a shot. These supplements can help increase the levels of vitamin B12 in your body. And there is another treatment, which is blood transfusion, and this is usually used for the most severe cases. This is also helping with B12 deficiency, and a combination with the above stated treatment can be the most significant. So here I would like to take the chance to talk a little bit more about screening, again, as it came up before, because that's the best way to monitor the nutritional plan and the treatment. So the test for pernicious anemia, the most common one, is the anti-intrinsic factor antibody test. This is a test that used to find out if the patient has classic or full-blown pernicious anemia. The test is classified as highly specific. If tested positive, the patient will be deemed as having autoimmune pernicious anemia. However, it is important to note that the negative test does not mean that the pernicious anemia is ruled out. Another test that is important to mention is the peripheral cell antibodies. This is another classic test for pernicious anemia. About 90% of those patients with pernicious anemia will have peripheral cell antibodies, so this test will come back positive. Another one to mention is the serum gastrin. When patient tests negative for antibodies but pernicious anemia is likely, this test can be used. It's 85 to 90% of the patients with pernicious anemia will have high serum gastrin. However, there are a few other tests that are important to mention. These other tests carried out as part of the full blood count include the following, which is MCH. This measures the amount of hemoglobin per red blood cells. A high concentration is indicating a B12 deficiency. MCHC, which measures the average concentration of hemoglobin in the cells, and red blood cell distribution with a measure of volume of red blood cells.